Hi, Bridget here, 2016, October 1st. You take these off, they're glaring. This is my first video I have done, and I am doing this video so that I can record and possibly share and educate people as to what's going on with my health. I do have a central line port, and about 3 weeks ago, when it was not accessed, I go 6 weeks on with access, and then 2 weeks off with my medication, and then 6 weeks on, 2 weeks off. During my 2 weeks off, I fell down a flight of stairs, right arm hyperextended behind me as I was going down the steps. Pulled some muscles in my chest. They have healed, but it brought the port to the surface. And injured the area. The doctor, this particular doctor that put the port in, does do internal stitches and to hold it in place, so there may have been some pulling or tearing. It's a subclavian port, meaning that it's cut. You can kind of see the incision right here, cut. Port put in, fed up. Subclavian means it goes over my clavicle up into the anatomy, but anyway, and then it's fed through the subclavian jugular and then into my heart. I made an appointment to the doctor, and the day that I was going to have it looked at, my precious little doxy head-butted me right in the port. And at that time, it was accessed, and it just was so tender. My home care nurse who accessed it was concerned because there was so much pain. I am going to record this just because somebody suggested, but there is some drainage. I went to the emergency room last Thursday, and this is Saturday evening. The doctor felt, they did an x-ray, and the interventional radiologist actually came down and looked at this, did an x-ray. He said that he had patients actually have a recoil of a shotgun hit the port and actually not fracture it or anything. And he couldn't imagine that the head of a little dachshund could do much damage. The x-ray was just fine, but he feels that I have, probably because of the headbutt and it was access, that we may, and the fall, created some tissue damage and infected the area. But I'm going to just, I'm hoping the lighting is good here. Just going to turn a little bit here. But I'm going to, there's the line right here, and I'm just going to go back and forth. Move this a little closer. Just going to go back and forth where the line goes up. And it's starting to drain. I don't know if you can see that little hole right there, pointing. I'm not touching the port. That little hole was created when the needle was removed. Very tender. I'm not touching at all the area. You can see some drainage coming down. There's a little hole there. I don't know if you can see that or not, but it's very, very tender. and they still think it's just a skin infection. Usually in the morning I have a lot more drainage. It is starting to run down. I'm hoping that you can see it is clear, a clear fluid. I have a little there goes my words again. Can't find them. My ear swab. But I have drainage that came all the way down. It is clear. When it's all together, it is a little, oh, here's the makeup trick, a little yellowish. So I made a decision not to access the port. The doctor thought it was okay to go ahead and continue my IVs and come home and be accessed, but I made a decision not to do that and just let the medicine do its work, because this is exceptionally tender. It's just a little alcohol wipe. But I'm just going around the outside, never touching the top. And there it's draining more. Oh. Tomorrow I am picking up at the drugstore some topical lidocaine patches. Just normally this area is covered with a dressing, so I haven't experienced this area not being covered before. So just even a shirt barely brushing against this area is very painful. Just the my hair is long, and just my hair falling over the shoulder and touching that area, even though it's covered with a Band-Aid, hurts. So tomorrow we're going to try lidocaine patches on top of it to see if I can get some comfort. So you can, I guess, infect this area and it not be the port itself infected, but it can be the skin around that. And we just decided, mostly me, the patient, decided not to access the port and possibly push infected material into the port, thus into the body. So, I don't like to say but this is my first video. I've been doing pretty well lately. Just freak accident, the fall down the stair steps, mostly due to probably the weakness in my legs, mitochondrial, or a foot slipped off the step. It happened so quickly that you know, it's just hard to remember. There wasn't anything on the steps, so I didn't fall, trip over a dog toy or anything, or clothing, nail. Anyway, just wanted you to know that you can infect this area, the skin area, and it not be the port itself. And I think that's important to know, because I was so fearful that I couldn't continue treating the Lyme disease. Once again, the doctor added another medication, and cephalexin, which is a good antibiotic for you know, skin infections, and I'm doing 500 milligrams 4 times a day. And I just want to send my blessings to everybody who's fighting an illness, and everybody who's caring for somebody who's fighting an illness, and God bless.